So in Florida, I had complained for about a year about a pain in my arm. And the doctors were doing the typical x-rays, et cetera. They even told me, you don't have cancer. And when they scanned my neck, they found a tumor in my upper lung. I went into the traditional treatment, 2 rounds of chemo, and then radiation. I was scheduled to do radiation for 35 days. I was the one who went to my oncologist saying, there's something wrong with my neck. The inside of my throat is constantly on fire. And he's looking at me and he goes, well, your skin's gone. And so he's the one who stopped the radiation. He said, you know, they should have been monitoring it more. Well, that made you feel even worse. And that's when I said, hey, I need to go to Seattle Cancer Care, get me back to Seattle, because I need somebody who actually knows what they're doing.
Did it change the family?
Well, we're closer, that's for sure. My brother, who's the more analytical one, he was the one checking out everything that was going on, making sure everybody read the disclosures and knew the risk, et cetera. My sister would fly up here. You know, she's in LA. She would fly up here every 6 weeks that I had scan results. I had to have fluids for 2 weeks, you know, and every night. So my son actually gave them to me, you know. He was part of that process. I was the oldest in the family, and I was still trying to protect everybody. So being weak was not an option. My current doctor took his time, probably the first 6 months of our relationship, as he was building that trust, because he goes, I know you don't trust our profession, so it's going to take some time for me to earn your trust again. And it did.
How are you doing?
I'm fine. How are you?
You look great.
So do you.
Yeah.
I can tell. Because if you don't have trust and somebody tells you they want to do something that's, you know, not traditional, the odds of you saying yes are like, no, thank you.
What she got was a medication that allowed her own immune system to fight the cancer on its own. It's much more intuitive than I'm going to give you some poison and we hope that we will kill more of the cancer cells than you. And because she has been doing so well, our visits are frequently centered on issues that are not medically related. Right. You know, we give each other advice in the most different things. I think that helps to establish a physician-patient relationship that I find the most rewarding aspect of my job. Over the last few years, I have established stronger relationships with my patients than ever before, and that's because they're doing so well for so long.
Sunshine, would you recommend this doctor to other people?
Yeah, definitely. He would be a pick.